Hi, good evening. I'm Dr. Philip McMillan. Thank you very much for joining me. I'll be talking about an important area called vaccine coercion and is it ethical? And this was primarily triggering my thoughts because of a recent interview with Professor Augusto Zimmermann, where we were discussing about vaccine mandates, whether or not they were unconstitutional. And so today, as usual, I'm going to be bringing you a paper. And so this paper will be about the unintended consequences of COVID-19 vaccine policy, looking at mandates, passports, and restrictions. This was published in the BMJ. And I'll be going through a few points with regards to that, just to clarify some of my own thoughts and highlight some of the issues that are likely to happen going forward. So, before I start, I'd like to remind you all that coming up just shortly in another few days, if you are interested, is the webinar looking at COVID long haul, infection and vaccination, my take on the science. And additionally, that's on Wednesday, and on Thursday, I'll be doing diabetes, COVID, and vaccines, essentially a prediction as to why I think diabetes is going to become one of the mainstay conditions out there over the next few years. And this is likely to be related to autoimmunity. These are just my scientific perspectives. And so if you're interested, please register the link below. So let's get back into the paper here. And this is an interesting paper. And I'll show you the information about the authors. So the article information here, what you can see, the main author is Kevin Bardosh. This is the USA. There's a number of people from the UK, USA again. There's Canada, again, the USA, Canada, USA. So there are a number of people involved in a cross and a multinational view on this topic. It was published in the 26th of May 2022. And so this has been around for a little bit, but I've just come across it as I was thinking about the question. So the point about what are the impacts with regards to vaccine coercion. Now, one important thing about this is that in reality, if someone chooses not to have something and you force them to do it, from a clinical point of view, there are some significant risks that are associated with that. And you shouldn't underestimate what we call the nocebo effect. And the nocebo effect is similar to the placebo effect. The placebo effect is more likely to be positive, where you give somebody a medication that is not a medication, they believe in it, and they actually get benefits. And sometimes the placebo effect can be up to 30%. It's quite significant. Mind over matter. Well, it works in reverse. If somebody is concerned about something and you force them to do it, the negative effects of that can then come back to be associated for that individual. So the negative effects, in theory, could be just as significant or even more significant than the positive effects. So these are really critical points to try and take into consideration as we think about this kind of situation. So, coming back to the paper, let's look in a little bit more detail at some of the points that I had highlighted here. So, this is the paper here about the unintended consequences. I've highlighted here a term, a few words here. So, restricting people's access to work, education, public transport, and social life based on COVID 19 vaccination status impinges on human rights, promotes stigma and social polarization, and adversely affects health and well being. In truth, we can say that we almost wish they had said that earlier. That had come out on the 26th of May 2022. By this point, most of the mandates had started to be pulled back. And this was largely because the science caught up finally with the politics. And the science was very simple. And for those who don't quite understand what the science is, the science effectively states that if you are using an injectable vaccine against a mutable respiratory virus, One of the problems is that you can't effectively train the mucosal immune system, that's the upper airway lining, against the virus. So you train the systemic system, so in the bloodstream, but you haven't trained the first barrier. And so, therefore, what will happen is that people will still get infected. But at the time, most of the information that was being put across and which was not challenged by the scientific community adequately was that if everybody got vaccinated, then the transmission would stop. Clearly, that's not the case, as there are some countries that are almost 100% vaccinated and there's still circulating virus. That's where the science catches up. It was primarily about reducing the risk of severe disease in specific individuals. That's really the point that was beneficial or important. And so, therefore, in that context, from a scientific point of view, why would you mandate something that has direct benefit to the individual? Some would argue that there was a reduction in transmission if you had the whole population covered. But as I said, it still would not have stopped the pandemic. That's the logistic problem. So let's get back to the paper and let's look at this section here I've highlighted. So again, they highlighted that the publicly communicated rationale for implementing these policies, such as vaccine mandates, shifted over time. Early messaging around COVID-19 vaccination as a public health response measure focused on protecting the most vulnerable. This quickly shifted to vaccination thresholds to reach herd immunity and end the pandemic and get back to normal once sufficient vaccine supply was available. And again, they highlighted in late summer 2021, this pivoted again to a universal vaccine recommendation to reduce hospital intensive care ICU burden in Europe and North America to address the pandemic of the unvaccinated. So that was the terminology that was being used at the time. And again, this was being pushed in a political sense. And clearly, they didn't understand the science, because the science would have told you that even if you vaccinated your whole population at exactly the same time, unless you completely stop travel and you could guarantee that everybody could have blocked transmission, it wouldn't have worked. And so, in reality, a lot of this was more about politics than it was about science. And it's very difficult for people to accept that the science could have been so flawed at the time. And the question still remains, if they could get that wrong then, what else could be being made a mistake with? That's my big concern. And this is where the issue about excess deaths comes in. I think that is completely being missed and overlooked. Definitely need to focus on it. But getting back to the paper here. So here we have another section. The mandates and passport policies have provoked community and political resistance, including energetic mass street protests. This happened across the world. Much of the media and civil debates in liberal democracies have framed this as a consequence of anti science and right wing forces repeating simplistic narratives about complex public perceptions and responses. And they're completely right here. When you think of what happened in Canada with the truckers, that created quite a lot of stir, and they stood up for what they thought was their human rights. In effect, there's still criminal charges, I think, against a number of people on this particular point. And you saw similar things in Australia as well. So some people took it quite negatively that they were being forced to do something. One of my big concerns is that, there are those people who stood and didn't get vaccinated, but what happens to those people who were actually vaccinated but against their will? That's a really important area. So let's just get back here to the paper, and we go back to another section here. When mandate rules are perceived to lack a strong scientific basis, the likelihood for public scrutiny and long term damage to trust in scientific institutions and regulatory bodies is much higher. A good example is the lack of recognition of infection driven immunity in employer based vaccine mandates and passports in North America, including most universities and colleges. This again is a really critical point. Can you believe that still in some parts of the US, they have vaccine mandates in universities and colleges in one of the lowest risk groups of people who should therefore be for severe COVID 19? That's clearly not scientific. As you remember, they highlighted the point that there was this transition from protect the vulnerable to stop the pandemic to insisting on the vaccines for the whole population. So there were two steps away from what we had started with when lockdowns had occurred. So this was very, very significant transition. And again, the science didn't fit the narrative. And that is something that the scientific community will have to come back to and say, well, why, when you saw these things being said, was there not much more pushback to say, hold on, that's not actually scientifically correct? Let's get back to the paper here. Citing the potential for backlash and resistance in December 2020, the director of the WHO's immunization department stated, I don't think we envision any countries creating a mandate for COVID 19 vaccination. Many governments originally followed with similar public statements only to shift positions, often suddenly, in mid or late 2021 during the Delta or COVID or Omicron surge, including in Austria, the first country to announce a full population wide mandate. And again, a lot of people forget what happened and how things were evolving. It was clear it was not the right thing to mandate a vaccine at that point, especially when you were in emergency use. Then you have to think about the fact that within about 6 months to a year, there needed to be boosters. There are so many scientific questions that needed to be clarified that to mandate it didn't seem to fit with the scientific position of giving people the right to choose about something that was clearly beneficial for them. Now, you have to remember that there was a high risk group and they tended to go along with getting the vaccine. But even those who chose not to, if they had previous infection, they could have been, that would have been natural immunity. But even if they didn't, was it right to force them to protect their own health because you were trying to reduce the burden on the hospitals? That would have been the logic. Getting back to the paper, here are some of the statements that were made at the time. And you can see here, this was from Emmanuel Macron. Only a very small minority who are resisting. How do we reduce that minority? We reduce them by pissing them off even more. When my freedoms threaten those of others, I become someone irresponsible. Someone irresponsible is not a citizen. Those are very powerful statements. And you have to realize that those statements still are ringing in the ears of much of the public when it comes to these things, because the public went along with this. They agreed largely. This is part of the reason why the politicians were able to get away with those comments. Moving down the line here, you had here as well. This one here is from Joe Biden. This is a pandemic of the unvaccinated, and it's caused by the fact that despite America having an unprecedented and successful vaccination program, despite the fact that for almost 5 months free vaccines have been available, we still have nearly 80 million Americans who have failed to get the shot. And at that point, they were saying for the unvaccinated, you're looking for a winter of severe illness and death for yourselves, your families, and the hospitals you may soon overwhelm. These were powerful statements, and these rung through to the public. There was quite a lot of negative press around this. And what can you say is that the reality is that that was not based on the science. I keep on reminding people that from a scientific perspective, you just have to understand how this virus works. Its primary mechanism of action is stealth. it uses interferon suppression so that the immune system doesn't recognize it's there until it spreads down into the lungs or spreads to other people. This is why it's able to spread so easily, because oftentimes when it is spreading, there are no symptoms. And so, even at that time, not understanding that mechanism of the virus and the fact that your only way of stopping it is with good mucosal immunity was not fitting the science. And again, history will judge us by the fact that science or the scientific community did not raise these questions and these challenges at the time. So we're going to get back to another section in this paper. I think that I've just highlighted a few things that I think were important. This one here was talking about disunity in global health governance, and they were talking about current vaccine policies risk further disunity in global health governance. And despite the WHO stating in early 22 that boosters would prolong the pandemic by contributing to vaccine hoarding and low supply, universities, including global health departments in wealthy countries, have mandated boosters for low risk healthy students and faculty when vaccination rates remain low in many low middle income countries. This is again another point, and as I said, it's just luck that the science was wrong, because think about this. If the science was actually correct and that the vaccines were going to make a huge impact with regards to life and death across the world, we left Africa to die. Think about that. Only 2% of Africa at this point in late 2021, I think, was vaccinated. So, in effect, the wealthy countries were going through booster campaigns, vaccinating children, when vast areas of Africa had not even had their high risk vaccinated. This would have been an unprecedented humanitarian disaster. So, in a sense, we're lucky that they didn't understand the science, because very clearly they would have left other people, low income countries, to have suffered at the time. That's really one of the saddest parts about the pandemic. It has revealed, in truth, the way how people look at low and middle income countries. They were willing to leave them alone just because they were afraid and wanted to protect even their lowest risk before they were willing to share anything else. A very sad indictment on the world. So, on the final bit here, this is now coming to the conclusion of the paper. And it says here the adoption of new vaccination policies have provoked backlash, resistance, and polarization. It is important to emphasize that these policies are not viewed as incentives or nudges by substantial portions of populations, especially in marginalized, underserved, or low risk COVID 19 groups. Denying individuals education, livelihoods, medical care, or social life unless they get vaccinated, especially in light of the limitations with the current vaccines, is arguably in tension with constitutional and bioethical principles, especially in liberal democracies. So that's the conclusion of the paper. And as I said, this is what the paper said. You can read it for yourself and have your own opinions on it, but it has very clearly delineated what I think was quite important with regards to the pandemic and what has come out of it. So the point about vaccine coercion, is it ethical? I think not. One could argue, and as I said in the recent interview, I asked him this question: if this was Ebola, would it still have been different? And he said no, it would still have been unconstitutional to mandate a vaccine if someone didn't choose to have it for whatever reason. So we have challenging times ahead, and it is important for us all to recognize where there have been failures in the system, where we have not taken adequately into consideration the views and the rights of our population. These mistakes still have to be addressed, And we hope that politicians will recognize that this should be thoroughly investigated so that there is no chance that this could ever happen again. Have a great evening.